Hi, everyone. So, this is a very important document that is published at the AHIMA website. It is called the Content Outline, as you can see at the top here. Sometimes you will also perhaps see it referred to as the blueprint. This is the document that's laying out for you the content of the RHIT exam as of the most recent revision, which was October of 2022. As previously specified here in this class, and as noted by the American Health Information Management Association, there are six domains. Those domains are topic areas. Doesn't matter what the name of the topic area is. That's the name that AHIMA and their team has given that particular content. You don't memorize the name. You don't memorize anything on this document, but this document is helpful because it tells you what the exam will focus in on. The exam will not be divided in domains. You will get, I believe you get each question separately. You will get a set of 150 questions. They will not be divided, like these 5 questions are domain 1, these 10 questions are domain 2. It's not organized that way. It's organized this way for you for study and review purposes. The first domain is called data content, structure, and information governance. The range here is 19 to 25%. What does that mean? That means on any given version of the exam, because there's multiple versions being given out. If one student A takes the version A of the exam, that particular exam may have 19% of those 150 questions may be focused on this area. Student B takes the exam, same time, same exam location perhaps, or a totally different location, but within they're still under the 10/1/2022 exam update. Their particular version B of the exam will have 25%. So there's not one standard exam that if everyone who's taken the RHIT exam since October of 2022 to now has all had the exact same 150 set questions. That's not how this works. That would not be good from a statistical standpoint. That would not be good from a validity standpoint to make sure the exam is secure. So there's multiple versions of the exam that are what we call launched, that are currently accessible. And when a student or a candidate, we call you a candidate when you go to take the exam, once you've gone through all the processes and you go to the testing site at your appointed date and time, once you log on to the computer will randomly assign you a version of the exam. You don't know what version you're getting. And it's not going to be the same version perhaps someone else is getting. It's going to have the same content, but it's going to be slightly different because they have a pool of questions. So they may have, 400 questions just for domain 1. It's going to pull a certain amount of those questions for that particular exam on that particular day. And so if we do basic math and we look at 150 questions, so that's about 37 questions. If the content of that particular area is up to 25%, you could have 37 questions focused on this domain 1. Domain 1 is ranging from 19 to 25%. And we'll talk about the other domains. The other domain that has a large amount of potential questions is domain 4. And domain 4 is on revenue cycle management. Within domain 4, it talks about revenue cycle, but it also is focused on actual application of codes. such as the information and the experiences that you learned in HIT 202, 203, 210. So coding application falls within domain 4. And then we have the other 2 domains also. So let's look at each of these individually. Domain 1 is data, content, structure, information, governance. That will include things about talking about data integrity, specifically talking about data integrity when we talk about it from the perspective of electronic health record. Talking about perhaps how patients can be assisted, or what are some of the challenges and strategies to help patients navigate patient portals. What are the things we're looking for as an HIM professional or an emerging HIM professional when we want to educate physicians on documentation or other clinicians? What's the current or the most recent sort of guidelines regarding auditing? That could be auditing from a coding standpoint or auditing for documentation guidelines. And then what are our current standards related to healthcare standards, related to health information guidelines? That could include information coming from CMS, etc. Now, for the most part, just looking here for a second. This part of the exam may not, or these types of questions on the exam may not include HIPAA. HIPAA may fall into domain 2, but it's possible. So meaningful use, data interoperability, health information exchange, and what are the rules of the road, so to speak, on health information exchange? What do you need to know if you are working in health information management and your facility wants to participate in the regional health information exchange? Those kinds of things are what we're looking at for data, content, structure, and information governance. How do you maintain and make sure your master patient index is correct? What do you need to be aware of for data workflow as an HIM professional? So those are the things we're talking about in this particular domain 1. Domain 2 is focused on privacy and security. That would include most likely HIPAA. And what's the difference between privacy and confidentiality? What are some of the risks associated with privacy and security? Right now, the number 1 risk perhaps is cyber risk, right? Someone actually getting into your employer-based systems. How do we determine if we're in that role or we're being asked to provide? What's the information we need to know about in terms of getting access to a health record? Can anybody get access to a health record? Can any doctor in the facility walk up to the registration clerk or email from home and say, I need access to Mary Lou Greenfield's record? If they are not the physician of record taking care of that patient, they don't get access to it. Hold on. Sorry about that. Real life. Just like in the classroom, my brief blew off my door. So we were talking about domain 2, some of our basic elements in health information about access to records. Physicians, not every doctor in a hospital has access to every record in that hospital. He or she, the physician or the clinician, has to have a reason for accessing that record. What are the record retention guidelines in general? Not specific for your state. Remember, this is a national exam. What are record retention guidelines in general? The typical guideline is 7 years. Now, that guideline has been around for a very, very long time. It does not specifically say electronic records. most healthcare facilities are keeping their electronic health records right now forever. There's no specific cutoff point. States do have some direction on that, but this is a national exam. It's not asking you what's California's law on record retention guidelines. That doesn't really have anything to do with the exam itself. It's important for you to know that as a working HIM professional. If you're working in the state of California, yes. But for this exam, national guidelines. So that's privacy and security. Next one is data analytics and use. Again, you can have a number of questions from 12 to 18%. So if we're talking about 12%, that's 18 questions. And if it's 18%, it's 27. So 12 to 27, potentially. You could have 12 questions, you could have 14 questions. But you won't know. They're not going to be labeled. But at the end of the day, when someone looks at behind the scenes, looks at your exam, they will verify that you received the right amount of questions within these ranges. Data analytics and use talks about external and internal data sources, analyzing data, reporting data. One of the things that could be in this particular arena is they may give you some information and ask you to identify perhaps what's the best graph or chart to be used to present that specific piece of data. The other element that's in this arena, this particular domain, is doing statistics. Good news is they will give you the formulas. You do not have to memorize. When I took the exam many years ago, we had to memorize forms. They didn't give us them. Now they give you the formulas. You will be able to do what's called a toggle during the exam. They'll have a tab at the top where you'll be able to pull up the listing of all the HIM statistical formulas. You still got to know which one to use. You still got to know which numbers to put where. They also have a calculator on the computer for you to use. But you still have to know how to do the statistics. You don't have to memorize, and you're not doing math in your head, but you are given the statistics. But doing the statistics, you may fall into this area. So potentially, you're not going to have 25 questions on statistics, but you could have, several questions that focus on doing statistics. You may have 3 or 4, and then you could have 3 or 4 different questions where they give you some information and say, okay, how would you present this? Now, the good news is, and we'll talk about that when we talk about test taking strategies, all of the questions are multiple choice. But they will have perhaps maybe 2 answers that you're thinking, which one of these is correct? Like you're debating between 2 answers. They're going to have what we call good distractors. Things that are like, oh, that definitely is wrong. You're going to have 4 options typically. And we'll talk more about in test taking, but they will have some distractors that you're thinking, is it A or is it C? And so there will be some that you're going to have to think about. And then my best advice, and again, I'll talk about it later, is to actually think about and answer the question. Don't look at the 4 options and think which one of these is right. Actually think about the question and try to figure out the answer. If it's a statistical question, do the math. Don't look at the answers and think which one's the closest to what your guess would be. Actually do the work, because you've had that opportunity, and now you've had this opportunity in this class that you will be practicing doing your statistics again. Then we have domain 4. Again, domains are just topic areas. Domain 4 is a higher potential area where they could pull questions from. And the focus here is revenue cycle management. That includes coding applications. So things that you learn about applying ICD-10 PCS codes. You're not using a coding manual. So if there are questions where they want you to code something, they will give you, you're not allowed to bring in a coding manual, is what I mean to say. You're not allowed to bring any materials into the testing site once you're in the testing room. So if you need to code something, they will provide you with the page from the coding manual if that's something that's needed to answer that particular question effectively. But in addition to coding or coding application, utilization review is under here. The different components of the revenue cycle process. How do we as HIM professionals work with CDI staff? What do we need to focus in on a charge description master and why? Different payment methodologies such as PPO, HMO, state-driven insurance such as Medicaid, federal-driven insurance such as Medicare. What are the basics of those particular different payment methodologies? We also talk about in your reimbursement classes, we talk about the inpatient prospective payment system, which includes MSDRG. We also talk about the outpatient prospective system. Common billing issues for inpatient and outpatient coding. And what is a case mix? And how do we look at it? Why is it important? What is a case mix and why is it important? So all those are in domain 4. Domain 5 is compliance. Talking about release of information, regulatory changes in terms of compliance. And then our last domain is domain 6. Domain 6 is focused on leadership. For the RHIT exam, domain 6 has the lowest amount of potential questions from 9 to 12%. Some of those questions could be focused on some of the basics of project management. Some things about what things you need to perhaps highlight if you're working with another department in terms of interoperability. What are some of the national standards, not state standards, national standards for chart completion, coding accuracy, release of information, turnaround time, and departmental workflow? What are some of your highlight areas when you're revising policies and procedures? And what are some of our national laws regarding health information? So again, those are the 6 domains or topic areas for the RHIT exam. You have the ability as we go through this class and use the book when you have completed, say, taking a set of questions. Let's just say, for the purposes of this illustration here, you were asked to, within this class, to take the domain 1 questions, practice questions. And in this particular book, I'm looking at this book. Let's see how many. They have quite a lot. They have 110 in one section. It's just one section of the book. They have 110 practice questions on domain 1. So you will know based on your results. So if you get, 50 of these wrong, and that's okay. That tells you need to focus in on this area. Domain 2, you may get, only 10 wrong. So that's how you tailor your review based on your results of perhaps the questions in this book or other questions that I do have in the class. I have questions that I provided that aren't in this book. I call those question or that format, I call them assessments. Once you take the assessment and you see, I didn't do so well in domain 1, which is not uncommon. Domain 1 is typically an area that a lot of students struggle with when they get to this review class. I think part of that is because a lot of that foundational element is things that are talked about in your HIT 101 class. And along the way, we build on it, but sometimes we have a tendency to forget some of the basic concepts. And perhaps we overthink a question. Or we forget what a master patient index is because we haven't really talked about it since HIT 101 or some of the earlier classes. If you love coding, maybe domain 4 is not a big deal for you. Maybe you're feeling comfortable with a lot of these things, but maybe you do need to look at charge description master. So even within a particular domain, there may be specific elements that you want to look at. The other question you might think about, or the other area you might want to focus in, is some people say, well, what is query? Am I going to be querying physicians? No, but you may be given 2 examples. You may be given on the exam, on the RHIT exam, you may be given 2 queries. And then you're asked to identify which one is a leading query. Or you may be given several scenarios, scenario A and scenario B, or scenario A, B, and C, A, B, C, and D, and you may be asked then to determine which one of those scenarios, there's only one answer, which one of those scenarios would you query the physician for more information? So it is a multiple choice exam, but you can still be asked a multiple choice question and be asked to determine based on these 4 pieces of information that's given to you on the exam, which one of these would you issue a query for? So it can be difficult to say, well, how am I going to do a multiple choice exam on quality assessments? You may be given 4 examples. Which one's the quality one? Which one's the best quality assessment? So pay attention when you're taking the exam, the actual question is being posed to you. A lot of times, not all, but a large portion of these questions that you'll see on the exam will be what we call scenario based. So here's an example. Now, this question is under domain 5 in your review guide. Domain 5 is compliance. This is how the question is worded to you. It says a group practice has hired an HIT as its chief compliance officer. The current compliance program includes written standards of conduct and policies and procedures that address specific areas of potential fraud. It also has audits in place to monitor compliance. Which of the following, and you have 4 options, which of the following should the compliance officer also ensure are in place? And you have again 4 options. A is a bonus program for coding professionals who code charged with higher paying MSDRGs. Is that something good that a compliance officer should do? Option B, hotline to receive complaints and adoption procedures to protect whistleblowers from retaliation. Is that something a compliance officer should also do? Number C, procedures to adequately identify individuals who make complaints so that appropriate follow-up can be conducted. Again, is that something that should be part of this particular facility's compliance program? And then D is a corporate compliance committee that reports directly to the CFO. So the first one says a bonus program for coding professionals who code charged with higher paying DRGs. That's not something compliance should be, that's actually against what compliance should be doing. So that's what we call upcoding. So you're going to reward coders for potentially going against ethical coding standards by assigning higher MSDRGs. Is that something a compliance officer should be doing? No. The next one is number C was procedures to adequately identify individuals who make complaints so that appropriate follow-up can be conducted. That's also against privacy laws. You don't want to limit or cause people not to report because they know they're going to be identified, and you know that that opens up the potential for retaliation. So having procedures in writing that says, once you make a complaint, we're going to go and find out who you are. That is not a good thing. for a compliance officer. That should not be part of a compliance plan and its written standards, which is what the question asks you for. It's saying, which should this compliance officer also ensure is in place as part of your conduct for your office, compliance office, and your policies and procedures. So now we have two. We have B is a hotline to receive complaints and the adoption of procedures to prevent whistleblowers from retaliation. And D is a corporate compliance committee that reports directly to the chief financial officer. Now, you may think, well, both of those could be okay. Both of those are good to be included. The bottom one, number D, the one where the compliance committee is reporting directly to the CFO, again, that's a conflict of interest. You're operating as a clinical facility only with the idea of financials. So we're going to make sure doctors are in compliance, and if they're not in compliance with documentation standards, whatever it is they're not in compliance with, we're going to report that to the financial officer. That's not a good thing. So the correct answer is B. A hotline should be established. It should be part of your policies and procedures. But the question on the exam, the option says a hotline to receive complaints and adoption of procedures to prevent whistleblowers from retaliation. So as a compliance officer, you want people to report concerns. So that question that I just read to you and went through the answers is a multiple choice question. It would fall under task number 2. That question is asking you as an HIM compliance officer, what's missing from a corporate compliance plan based on the 4 options that you were given. And you're making that critical decision based on the information on the exam and information in the question, but also based on your knowledge base of what's good for a compliance officer to do and what's not so great. So that's one example of how a task goes from being part of a content outline to an actual exam question. Again, I would encourage you to print this out or perhaps save it to your personal computer. If there's a significant delay between now, when you're taking this review class, and when you actually take the RHIT exam, I would encourage you to check and see if there's been any changes in this content outline so that you are up to date on what you will be tested on in terms of topics or domains and specific tasks under each of those areas. Take care, everyone.